Morning, everyone. Am I audible? Yeah. So, good morning, everyone, and welcome to the side event. The title of the side event is Gender Equity and Social Inclusion in Citywide Inclusive Sanitation, a Discursive Perspective. And you all know that this is the side event actually are organized by jointly. So CREA in India, and also there are two other co-organizers, UN Habitat from the Nepal and Practical Action from the Bangladesh. So my name is Uttam Kumar Saha. I work with the Practical Action in Bangladesh country office, and welcome all of you to this side event. Just to I want to give some of the highlights of the side event. So let me share the objectives of the side event, because why we are actually organizing this side event, basically to build the sensitivity and capacity of WASH practitioners on gender aspect of the sanitation in South Asia. Although we have one presentation from Southeast Asia as well, intersectionality and right perspective, aiming to meet the citywide inclusive sanitation goals and implement inclusive sanitation programs effectively. And the second objective is introduce and discuss gender and intersectionality concepts and their relevance in the sanitation sector. The understanding the gender inclusive frameworks and tools, and also we have scope to learn about integrating gender inclusive urban sanitation through citywide inclusive sanitation. And this session we are expecting will enable participants to grasp marginalization based on gender, sexual diversity, disability, and specific sanitation needs. And of course, this will also allow to orient participants of the significance of the gender disaggregated data and the gender sensitive sanitation policy, gender friendly workplace facilities, and gender audit of urban sanitation programs and the citywide inclusive sanitation frameworks. So let me share what is the outline of this session. So we are expecting a number of speakers. So first, we will have a speaker who has already joined with us virtually. She is Soumya Tiwari from the CREA in India. She will present basically the introduction of integrating the gender, sexuality, and rights in the urban sanitation. After that, we'll have presentation from the Bill and Melinda Gates Foundation. We have Ms. Clara from who is the gender lead in the WASH team from the Bill and Melinda Gates Foundation. She will brief overview of the gender in the citywide inclusive sanitation. And then we will invite another colleague from the India Urban Management Center in India. He is Anurag Anthony. He will focus on gender and social inclusion initiatives in India. And of course, as we are talking about the citywide inclusive sanitation, our attempts are not only at the household level. Equally, we consider that it will be very wise to share some of the experience for washing institution. So as part of that, actually, we have kept the provision for washing healthcare facilities experience that will be presented by Nishka Sania. She works with the SNB in Indonesia. And then we'll have another presentation that is also around the institution. That will be delivered by Sudarshan Newpen, who works for the Trade Homes in Nepal. And of course, there are two other presentations from Bangladesh. One is from the International Training Network from Bangladesh University of Engineering and Technology. So they have recently done a global, study in the Bangladesh part of a global study. That is MUSE, Measuring Urban Sanitation Empowerment. So Mr. Alauddin from the ITN Board, he will share the presentation. And at last, I will again present the gender mainstreaming in the center in citywide inclusive sanitation. That's the experience from the Practical Action from Bangladesh country office. So that's all about today's plan. But we will also have scope to ask questions during the presentation and also after the, after this presentation and after the full, when the all presentation will be covered. And we'll have another open discussion and wrap-up session that, and the whole session will be moderated by Dr. Tanvi, who is basically, who is the director of International Training Network of Bangladesh University of Engineering and Technology. So this is the overview of the session. I think we can start now, and I can invite now Tomo from the CREA India, and at the same time, I'm also requesting Dr. Tanvi to moderate the session. Yeah, that's all about from my side. Yeah, hope you will enjoy the session. Yeah.
Thank you very much. So without further ado, let's get on with the first presentation from CREA, integrating gender, sexuality, and rights in urban sanitation. So I think you have joined online. So please go ahead, and if you need the assistance in changing the slide, just mention that next slide, then I can help you with the slide rotation. Thank you. So I'd like to invite Somo from CREA.
Thank you, Uttam. Thank you, Tanvi. My name is Soumya, and I'm from India. I am a social worker, and I've studied social work in public health in India. And I've been associated with CREA from past 2 years in its advancing sexual and reproductive rights strategic objective. And today I'm here to present about our program, which is called Integrating Gender, Sexuality and Rights in Urban Sanitation. CREA was founded in 2000, and it's a feminist international human rights organization which works at community, national, regional, and global level. And it is one of the first few international feminist organization which is based in Global South. CREA's work basically works around building feminist leadership at grassroots, strengthening movements, challenging unjust power structures, expanding sexual and reproductive freedoms, and advancing the human rights of the structurally excluded people. So following this, we have, I think the slides are a bit messed up, but next slide. Okay, so this slide basically shows the Sustainable Development Goals, and what I wanted to discuss through this slide was there is a very apparent interlinkages and interdependence of all these SDGs with SDG 6. So we cannot look at these goals in isolation. And when we look at SDG 3, talking about health, whether we talk about reducing school dropouts for women in India and availability of MHM provisions and water and sanitation, we see a clear interlinkages with SDG 4 to SDG 6. So this helped us frame and actually develop a call or an urge for all WASH actors to come together to work, not just focusing on one SDG, but looking at all these SDGs and how they are directly interlinked and interdependent, and defining the outcomes of SDG 6. So looking at further and like looking deeper in SDG 5 and its linkages to SDG 6, we did a lot of research, we did a lot of FGTs with communities, and further saw, next slide, that sanitation is a gendered service. If we look at the biological aspect, we saw that there are life cycles of women and girls, and access to sanitation is different in different life stages. And the impact of not having the access to sanitation at different stages is different for women. And in India, there is a further care burden that they carry, and need of privacy that they have, and social cultural norms that define whether women would be able to have access to sanitation or not. There's a very interesting case in India which we were able to document ourselves, that an entire community situated in a state was not able to have toilet constructed in their areas, in their area, because of a presence of a temple. So a presence of a religious monument was so the community believed that building a temple would be not suitable. So an entire the entire community does not have toilet in their region. There is also sanitation related stigma that we face, taboos related to MHM, which is heightened in India, and sexual harassment and violence that women face when accessing public toilets in communities, especially in slum communities. So there are biological aspects, there are social aspects which highlight that sanitation was a highly gendered provision. Next slide. The good news was this has been recognized, studied, identified, and our legal and policy framework have documented them and have made provisions mandated through its policy Swachh Bharat Mission and Amrut that women, transgender, persons with disability, elderly, and children should be included in the sanitation service and their access should be ensured. There is also the right to sanitation, which has been interpreted by courts in India as right to life. But when we did our research, when we worked through with communities, with slums, with women, trans persons, sex workers, we realized that at the ground, these legal and policy frameworks are advisory in nature. So we could not hold any institutional structures accountable, and thus they were limited in their in how much they can make an impact at ground. There was also no separate budget allocation. So with an umbrella budget, there is no provisions of making sure that these inclusion is being prioritized within the larger framework. We also see that while these have been mentioned in various documents and provisions, there is no understanding of those who are implementing these at the city level. So we have urban local bodies, but they do not have any understanding on what it means when we say inclusive sanitation. And there is also no data available, especially gender disaggregated data available, which makes it more restricted for any data monitoring or evidence to be created. Next slide. So we realize that it is just not enough to say that access to sanitation is required and their presence in policy will be able to address these gaps. We know that the trans persons community in India is highly discriminated and they have reported facing harassment, stigma, and violence when they try to access sanitation. There is also groups like informal workers and sex workers whose sanitation needs have not been studied enough or not been documented and are not part of any policy frameworks also. So these are the kind of exclusion that CREA has been trying to study and further highlight. India is also trying to address a very serious challenge which it faces in terms of caste-based occupation. So there is sanitation work is a highly caste-based occupation which is done by which is taken up by the so-called lower caste communities in India. And when we look at it through the gender lens and disaggregated by data, it is further, we see that majority of women are contractual or outsourced sanitation workers. So they cannot ask for the same benefits from their employees. They bear the stigma and status of the work and they have concerns related to sanitation. Next slide. Next slide. So because of all of the learnings that we had from this program, CREA has been able to reframe the gender inclusive and social inclusive framework, the GESI framework, into our own 6 strategy framework, which we felt would be applying more to the sector. And through this, we are trying to integrate gender sexuality and a rights perspective. The strategies are capacitate, where we are bridging the gap of understanding about what it means when we say inclusion of trans persons, sex workers. So we are building their capacity through training programs. Next, please. Communicate is building more knowledge material and also challenging what the existing cultural and social stigma says about sanitation and stigma related to it. Next, please. Complicate, we have been organizing dialogues and learning forums. We are bringing disability justice, sexual and gender diversity groups, migrants groups, sex workers, and all of them together to have more discussion on what it means when we say access to sanitation and what have been their experience related to sanitation. Next. Next. So connect. We are curating best practices at national and global level, and also making sure that it goes into a repository which is accessible to all inside South Asia. Next. Great. Through this, we have been developing training content, which is more specific to the particular stakeholder who will be taking this training. So it is different for a government official, a self-help group who is implementing a community level sanitation or MHM program, or our local body. Next. Convene. Yes, through this, we are trying to have a discussion between different social movements, feminist movements, health movements, and sanitation rights movements to talk about the intersections that is present and how can we strengthen the right to sanitation in India. So through this 6 strategies, we have developed the key components. So this presents a larger structure, the verticals we've been able to create, and how we are delivering this project from past 2 years. There is, I think the time is up. I tried to make it in 5 minutes. So thank you so much. If there are any questions at the end, I would be here. Thank you so much.
We'll leave the Q&A for later. So let's move on to a brief overview of gender in citywide inclusive sanitation from Kara O from the Bill and Melinda Gates Foundation.
Good morning, everybody. And Suma, I'm so glad you were able to join us. We weren't sure that she would be able to be here in person, so I agreed to step in and provide a framework to help carry us into the more practical parts of our discussion, which I know are coming next from our colleagues. But Suma, I think, really started it off nicely by showing the many, many dimensions that are involved in CREA's work with the Citywide partners in Asia. So before we go further into that, I don't want to presume that everyone in the room or online knows what Citywide is or has the same understanding of why gender mainstream approaches are needed within Citywide. So that's what I'm going to attempt to briefly do and just share with you some of our thinking and I think some of the thinking that has influenced the conversation you'll hear today. So before I go into this, how many people in the room are doing gender mainstreaming work, either within their organizations, programs, institutions, research? Okay, a fair amount of you, which is great. And how many of you know what citywide inclusive sanitation is? Fantastic. This is going to be easy. Okay, so what is citywide inclusive sanitation? It's really not meant to be complicated. It has a sort of branded name, but it's really about a philosophy and an approach to covering an entire city and reaching all people, including the poorest of the poor, including women and girls, with adequate, safe sanitation services. So Citywide looks to shift the urban sanitation paradigm, aiming to ensure that everyone has access to safely managed sanitation by promoting a range of solutions, both on-site and off-site, centralized and decentralized sanitation systems. And it's tailored to the realities of the world's growing cities. Citywide means focusing on service provision and its enabling environment rather than simply on building infrastructure. So it's really about a shift in approach and a shift in mindset that will then lead to the core outcomes that best serve the needs of everyone, including women and girls. So I think what I really want to drive home is that the Citywide approach is a gender inclusive approach. You can see that gender and social equity are kind of some of the main staples of the Citywide approach. In order to reach everyone, you have to also be tailoring your services and your approach to women and girls. They're not an afterthought. It's not a cross-cutting element. It is the goal of citywide inclusive sanitation. So in short, everyone in urban areas benefits within Citywide from equitable, safely managed sanitation services. And the key parts here are who then is responsible for that, facilitated by an authority mandated to ensure that those services are delivered, irrespective of the technologies, business models, or partners used to achieve. So it's not articulating a specific approach. Again, it's really about the outcomes and the functions of Citywide. And that's what I mean when I say the outcomes and the functions. We call this our 2x3. If you've participated in Citywide's programming, you'll have seen this and you'll probably see this again. And it helps keep us focused on the key questions and outcomes while remaining flexible about the how, the different institutional models, maturity levels, and settings. So to achieve the 3 core Citywide outcomes at the top here, equity, safety, and sustainability, I think all of these are applicable to a gender inclusion and social inclusion lens, especially equity and safety. In order to achieve those outcomes, you need the functions, the Citywide core functions at the bottom of responsibility, accountability, and resource planning and management. So we believe that if we, achieved these outcomes by doing these functions, we will be implementing CWISE, and that is what our partners are here to talk to you today about. So continuing on with the framework and the language and the definitions, I just wanted to very briefly touch on the Bill and Melinda Gates Foundation's approach to gender mainstreaming and our WASH logic model for gender inclusion. Now, I think most organizations have some similar, but perhaps slightly different ways of talking about gender. So I put our definitions here. I think the definition of gender is that it's a socially and culturally constructed idea of what it is to be male or female in a specific context. And what I really like about this definition that I use and that we use is the very last sentence under that first paragraph. Gender is a relational concept. So everything that Suma was talking about and everything that you're seeing here today, when you're looking at the CWISE continuum, it's about how people interact and how they are treated because of their gender. And as a result, there are very specific needs. It's very complex. I think Suma did a great job of articulating the complexities in the first presentation. And for us, we use the term gender integration, gender mainstreaming. I think Suma said Jesse, some people say Jedi. Everyone's using slightly different terminology that I think ultimately mean the same things, which are looking at how gender inclusion and gender equity work shows up both in our programming for those who we're trying to serve and also within organizations ourselves. So within our organization and our team, we're approaching gender mainstreaming with the lens that's looking at both our organizational strategy and how we work together and how we work with our partners and how our partners work, and then ultimately the work that we're trying to do to benefit others across the world. So this is the WASH team, Water, Sanitation, and Hygiene team at the Bill and Melinda Gates Foundation. This is our internal gender logic chain. This is just meant to reflect our work and how we see our gender inclusion, gender mainstreaming work happening amongst our partners and grantees, many of you who are here today. So we really have looked at what are our inputs, what are we funding, how does this reflect our strategy? We're looking at transformative sanitation technologies developed with an inclusive human-centered design, paying particular attention to the needs of women and girls. Commercial partner global access strategy that helps ensure that those technologies will be available to those who need them most. We're creating programs, networks, and tools to strengthen and increase women's participation in the sanitation sector, both formally and informally. We're doing a fair amount of capacity building. By we, I always mean our partners. I'm saying the very broad we here for sanitation sector and relevant audiences on issues related to gender and sanitation, advocacy and support for gender intentional sanitation policies. There's some really exciting work that partners are doing in sub-Saharan Africa with the African sanitation policy guidelines, for instance, making sure that countries have the support and the tools and technical assistance they need to embed Jedi into their country sanitation plans. Behavior change and communication efforts targeting sanitation gender norms, engagement of community organizations. I think we'll hear about that today, especially in our South Asia context, and research and measurement efforts to disaggregate data by gender and account for gender differences. We're really supporting the global work that is happening to ensure that SDG 6.2 has gender-specific indicators down the line. We want to make sure that we're supporting and putting our voice and efforts behind JMP's efforts and others that are doing that work. And so then you see all the outputs. I won't go through all of them. What I really want to emphasize is our outcomes that we're driving towards. So access, this is about having sustained access to female-friendly, safely managed sanitation facilities, ideally including a toilet at home. In our earlier presentation, we talked about how access is complicated. It's not a one-time thing. And this is very tricky. Access is easy to say and really hard to do and sustain. So I just want to make sure that you know that we know that, because it looks overly simple here, I think. And then we want to promote the agency of women at a household level, at an individual decision-making level, at a family level, and thus far along the sanitation value chain to ensure that they can advocate for their needs and their family needs, both personal, household, community level, related to sanitation, and influence those decisions. And then going even further up the chain, I think we're looking at women in leadership positions. We want to ensure that women are in the room to help make decisions and help guide sanitation policies, services, and outcomes across the entire sanitation sector. So we're really focusing on these outcomes through the work of our partners. Ideally, we'd love to have the ultimate, I think it's hidden by the video there, but that's kind of our overall impact goal, is improved sanitation well-being. We're thinking about, is it possible to have a well-being or wellness or quality of life index that really combines all of this? Because I think we know that it's about dignity. In the opening plenary, they said sanitation is dignity, and that is very key to our Jessie strategy and our gender inclusion approaches within citywide sanitation. So again, just, thinking of all of what I've just said, looking back at the CWISE value chain and the CWISE approach, I hope you'll see that when we're talking about citywide inclusive sanitation, gender isn't separate. There's not a separate gender approach. Gender integration is really embedded within. And I wasn't sure if our colleagues from CREA would be here today, so I was going to just run through a couple of slides about them. I don't really need to do that, but I will say, I think what's interesting about our work with them and their work with you and with our partners is that rather than supporting a sanitation org to kind of beef up their gender technical expertise, we were lucky enough through our colleagues in India to identify CREA, an existing feminist rights organization, and invite them into the sanitation space. Now, we found this to be a very effective way to provide targeted technical assistance to our partners in India at present, and hopefully increasingly our partners across Asia. So there's a lot of cross-learning happening from those you'll hear from today, and we're really grateful to everybody for your work and for inviting me to speak today. So thank you, and thanks to CREA for joining us virtually.
Thank you very much, Anna, for highlighting BMGF, how BMGF is shaping up the landscape with respect to gender. I need to mention here that if you look at SDG 6.2, it mentions that achieve access to adequate and equitable sanitation, blah, blah, but it writes there, to the paying special attention to the needs of women and girls, and in this vulnerable situation. So in 2015, we already have this notion of gender inclusion, but how it is actually going to be incorporated and manifested through development projects and programming, that part was actually not clear. And I think that this CWISE concept, in looking through these outcomes and functions, many of those things have become clearer. And it will become clearer probably in the next few presentations that we have. We have 5 presentations. And at this moment, I'd like to invite Anurag Anthony of UMC India, and to talk about gender and social inclusion initiatives in India. Thank you.
Thank you. Very good morning to everyone. My pleasure to be here. And my name is Anurag Anthony, and I'm from the organization called Urban Management Center. And I'm being mistaken for UNC instead of UMC very often. So I'm not saying the acronym anymore here. We are a non-profit organization, and our genesis is about 26 years old with ICMA, which is the International City Management Association based out of Washington, DC. That's an association which brings cities together, city managers together for capacity building, for solving problems of each other's cities. And city-to-city partnership is a tool that they have used for long. And our organization, Urban Management Center, is an offshoot of ICMA, which started work in South Asia. And in India and South Asia, we work with local governments to improve their services, to professionalize them, and to make the cities better, irrespective of gender. But 60% of our time goes in water sanitation. That's the pressing issue in the region. And with that short background, I'll straight away jump into what I'm here to talk about today. In terms of gender mainstreaming and gender inclusion in all our city management, in planning, there are 2 cases I'll talk very quickly about today. The first one is about a women-led community engagement platform for improved water and sanitation. And the other one is the entire movement of self-help groups. Many of you must be aware what self-help groups are. This is a congregation of 10, 12 individuals. And the Indian context, 90% of the SHGs are women members from vulnerable populations, often below poverty line. Looking at the first example, where I'm going to talk about women-led community sanitation initiatives, we had a project from 2018 to 2021, where we looked at 4 cities in India and how we can improve water sanitation at these 4 locations. Our vehicle to deliver improved sanitation was to create women-led committees in slums. And we were working in 206 slums, to be precise. And what we did is gathered around approximately 10 women from that slum. we trained them, capacitated them so that they can resolve civic issues around WASH and much more beyond WASH as well. Now that became the first step to create this community engagement platform. And there was a formal structure given to them. There was a membership, they maintained a register of who are their members, what do they do, what can they contribute. There were positions of the secretary, there were treasurers, there were president of the committee, and they started mapping their settlements as you see on the right side. They identified the location of the slums, where are water problems, where are sanitation problems, and so on and so forth. And they created a beautiful profile of their settlement, which the municipalities never knew existed. Having done that, the base work in place, the next step was what do the people of this urban poor settlements want? And women again stepped up and led the entire discussion and prepared something we call settlement improvement planning. And as you see, literacy levels varied. People would write, people could draw, people would draw a chalk-based rangoli. What you see on the picture on the right, on the left here is a rangoli that they create outside their doors every morning. So these different participatory tools were used so that this participants can, reflect, or they can present the aspirations that they had to improve their settlement. So this is more like an urban planning exercise at ground zero. And all of this got compiled, and this had to be translated into a urban planning and municipal language. And that's where, as an organization, we stepped in and connected them to the municipal bodies. People also drew timelines of their settlements that we got flooded in 1988. Post that, we didn't see any floods for the 7 years, but then again, 1995, we had floods or some other problems and we were relocated, and so on and so forth. Now that helped build history of every settlement. That information is there in people's mind, but never captured or recorded anywhere. And once you have this information, municipalities can take the right kind of decisions, and they can align it with their future plans for improvements. And in the end, every settlement felt proud about what they did, and the women's committee created these kind of chart drawings, and they pasted it in the most prominent locations in their settlements, often near the entrance or near a temple or a mosque or a school. And this became the matter of pride for every settlement, that they are doing the improvement. Not just improving, they were also helping the city government monitor the services. For example, what you see on the screen is called a bindi chart. So bindi, most of you know, is the ornament that is worn on the forehead, a red, a yellow, and a green. It's a traffic signal, kind of an indicator. When they're happy with the cleanliness of a community toilet, on that day, they would mark it as green. And if they're not, they would mark it as red. Now, this spanned over 30 days, presents a monthly monitoring MIS. This is the basic of any MIS. And the city government now has this information to make sure that they can hold the contractors accountable if the toilets are not clean, if there's no water or there's no electricity or the doors are broken, and so on and so forth. So just by women leading from the grassroots, helping the municipalities as partners and not as people who are generally, protesting outside municipal offices, that changed the entire scenario. And like I said, they pasted their settlement charts at the most prominent locations in the slums. I'm an architect by qualification, and the only buildings I've ever constructed are toilets. And I'm happy about that. But I was humbled in one of the experiences when we were doing a community toilet design. And we thought, let's get the women and other participants from the slum to design their own community toilet. And most of us, partly including me, we thought, okay, maybe there may be some specifications, but what will be a drastic change? There are 5 templates, maybe this one or that one with some change here and there. And I was really humbled when I realized how wrong I was designing toilets for 15 years. And now I'm learning it again, how to design toilet with the people. So we created, this happened during COVID. So there were many problems that people wanted to address. So we used 3D blocks, we used cutout paper cutouts, we used, in a session like this, there'll be a 3D modeler kind of drawing their picture, the 3D-dimensional drawing of the toilet, and it's being displayed on the screen. People come and ask for changes. And what emerged as a toilet like this, eventually the product is not important. And I'll tell you an interesting anecdote here. In this very toilet, women said that we want a courtyard in our toilet. And I was wondering, why do they want a courtyard? I understand there's ventilation, light, and all of that. But they said, no, after we take a bath, we want to dry our hair, we want to dry our blouses, we want to dry our petticoats, which are a lining material inside a sari. And in that meantime, we also, we kind of give bath to our kids and they're playing around. So we want to spend an hour and a half after we take bath. And that's why we want a courtyard here. And no toilet, I can guarantee you in India, surely, no toilet in India constructed by municipality ever accommodates a courtyard for women. Now, that was a really humbling experience, and I'm more than happy. I'm happy that I went through that process, and something like this came up. If we're not 2 minutes, okay, we're running short of time, so I'll not come to the second anecdote. But that was an interesting one. Sorry, Dr. Tanvir, I have to mention this. In another location in India, when we were designing toilets, people said, after we cremate somebody, after a funeral, we can't go back into our houses. We have to go take a bath somewhere. And that bath has to be in the open and not inside a building. That's some cultural practice in some certain parts of India. And that's what they said. We want a bathing area without a roof because we can't enter a building, and it should be from the external, it should have an external access, not through a main entry of the building. Now that's something no toilet guaranteed in India ever accommodates in terms of design. So that's the other anecdote. So if you start engaging women and community into designing stuff for you, there's a whole lot of things that we learn, and municipalities have no ways to or means to integrate all of that. I'll very quickly come to the second case that I wanted to present. So in India, we have these self-help groups. That's a model being promoted and being pushed as a vehicle for delivery for the last 15 years by the government of India. And this is, like I said, mostly women, but their participation in sanitation has been very limited. And that's what we have been trying to work with the government of India. So as a part of this program, we have a team sitting with the Ministry of Housing and Urban Affairs in Delhi that supports the ministry to integrate sanitation workers, women, and the self-help groups together and creates livelihoods. As a result of it, I'll just quickly run through a few pictures. We have women masons who are constructing toilets in India now. That's not known of. They are generally head loaders in the construction industry. They would be loading bricks, but they wouldn't be constructing. There wouldn't be masons. There are women self-help groups that are operating as contractors, the public and community toilets in India. There are groups of transgenders that are operating fecal sludge treatment plants in India, and they have been federated as SHGs. There are women who are driving EVs to collect door-to-door waste from households in Odisha, in all local governments of 114 urban local bodies of Odisha. There are women who are running recycling centers. And what does it translate to nationally? As of now, we have about nearing 1 million self-help groups. That translates to 10 million urban poor women federated into self-help groups. And there is a whole institutional structure that you see that 10 self-help groups come together as an area level federation. 10 or 20 of them come together as a city level federation, and these are all registered bodies. And I'll take 10 seconds. And having legitimacy of being a part of an institution to urban poor women, that catalyzes a lot of things. And that's my key message here, that you give voice, agency, and authority to women, and they will be able to deliver a lot more than sanitation. And with that, I'd like to end. Thank you so much.
Thank you very much. I believe we can hear about this over half an hour and won't get bored. But now I'd like to invite our next presenter, Sania Niska, SMB in Indonesia. Please.
Okay, good morning, everyone. Thanks for having Indonesia in this South Asia group. It's a pleasure to be here. My name is Sania Niska. I'm representing SMB, working in Indonesia. So before we start, we're going to share our learning from participatory platform to ensure equitable wash provision in healthcare facilities in Indonesia. So I thank Kara for the nice framing presentation around citywide inclusive sanitation. And we hope that we can complement the other learnings from community segment with this learning from healthcare facilities.
How can we enable equitable wash services in healthcare facilities? By eliminating ambiguity in stakeholder roles and responsibilities to enable a health system that's truly accountable to all.
Perubahannya untuk akses disabilitas itu sudah tersedia.
Today, members of WASH in HCF, multi-stakeholder platforms in Indonesian cities, have introduced the appropriate checks and balances to hold each other to account. Watch the change unfold.
Teaser, guys, I will share the complete video link later. Okay. So this is a bit of our background, why an urban sanitation program focused on WASH in healthcare facilities. So SNV is implementing an urban sanitation program in 3 cities in Indonesia, which we assist the local government to engage households and institutions, including schools and healthcare facilities, to improve their access to safely managed sanitation. And within this program, we consider that healthcare facilities, especially the primary health centers at sub-district level, to play a key role in promoting safely managed and hygiene behavior in communities. These primary health centers are part of the city sanitation promoter team. They are the key actors promoting safely managed sanitation and hygiene behaviors at community. They are also the one who monitor the access at household level. And I think we believe that it is important to engage them and ensure that they themselves have access to safely managed sanitation in their facility. So we started our initiative back in 2020 with a study on WASH in healthcare facilities, where we assessed the gap between national regulations and the actual practice at city level. And these are some findings that we learned. The first one is around regulations about WASH access and quality in healthcare facilities are available at national level, but scattered. And then there is also very limited mention around WASH and GSC in national monitoring system. The responsibility of healthcare facility staff on maintaining WASH facilities is also unclear. No technical guidance on WASH compliance and standard in healthcare facilities. And in our cities, over 80% of the primary health centers still have limited sanitation access. So the process we started the gap analysis, and then we developed an indicator for WASH in HCF improvement. We tested, piloted in 6 primary health centers in 3 cities 3 years ago. And then in the last 2 years, we adapted the WASH Fit tool by the WHO and UNICEF. We integrated GSC elements, safely managed sanitation, and social accountability aspects into the tool. And we implemented this adapted tool in 14 primary health centers in 2 weeks in collaboration with local partners. Last year, we concluded the initiative, and then we disseminated the results. We advocated also for replication using the local resources. Some of the learnings on how to attain equitable WASH provision in primary health centers is that we form a multi-stakeholder partnership platform that is transparent, inclusive, and socially accountable. We learned that the primary health centers don't have clear responsibility on improving their WASH facilities, and they never engage other partners outside the healthcare facilities. So what we did was assisting them engaging with external partners like women's group, organization for people with disability, community representatives, as well as media and university. So we assisted them to establish a working group within the primary health center, who is a dedicated team in planning and monitoring the progress in terms of improving the WASH facilities. And we ensure involvement of this following stakeholders. So the City Health Office, of course, as the duty bearer, and then the public service providers. So it is the health center staff and management. And also we involve users representative. So community cadres, women's group, and people with disability. And also at the city level, we initiated a forum to facilitate broader discussion and dialogue to monitor the improvement and hold the government accountable for the access. We learned during the 2 years process that knowing what the approaches are there and adapting as needed is important. So we didn't try to reinvent the wheel. In Indonesia, WHO and UNICEF engaged some of the partners to implement their WashFit tool. So we used the WashFit and adapted to our context. And then we also assessed the facility using this tool and identify areas to improve and prioritize together with the partners. And we also ensure the active participation of all the partners throughout the process. So we started indicator adaptation together with them. We assessed the progress, and we also developed the improvement priorities together with the working group and the WASH in Healthcare Facilities Forum at city level. The outcomes of this multi-stakeholder platform formation is that we learned the increased knowledge and skill of the primary health center staff and the city health office in terms of safely managed sanitation, the importance of WASH in these facilities, and how they prioritize the improvement based on the needs. The second one is we also observed increased commitment to take corrective action and to allocate budget, because they have several funding resources, but then back then they didn't know how to prioritize and how to allocate these different funding sources. And we also saw a lot of a stronger commitment in actually roll out the improvements. And at city level, we observed increased local government buy-in. So in one of the cities, the mayor himself allocated an increased local budget to replicate the approach to the other healthcare facilities in the city. And the outcomes of the adaptation of the WashFit tool is that we saw that the healthcare facilities improved the toilet and they accommodated universal design toilet, and then they designed these improvements together with the users. This improvement also has seen in hand washing station, also in menstrual hygiene management facility in the healthcare facilities. Also can be observed in solid waste management. And in terms of management, the healthcare facilities also developed the SOP for improvement and operational and maintenance for the wash facility. Some of the key takeaways from this initiative is, first, we have to start with the higher level of the city. So we started with the mayor, with the wife of the mayor, with the health office and head of the chief of the health centers. We advocated them on the importance of WASH. We trained them and assisted them to increase their knowledge and awareness around this issue. We also ensure that this initiative aligned with the mayor's vision and mission for the city to allow them to allocate more budget for this replication. And we also engage media to disseminate the good practices and to boost up primary health centers' confidence in rolling out the improvements and sharing the practices to other primary health centers. And the last one is, of course, partnering with local CSOs, local women's group, local organization for people with disabilities is essential for improvement acceleration because they are the one who know what they need in the healthcare facilities, and they are also the one who identify the need and propose the improvement needed in the centers. That's it. This is the full link of the video that you can watch it later. Thank you. Thank you so much.
Thank you very much. We shall move on to the next presentation, then we shall spare a bit of a time for a Q&A. So now I'd like to invite Sudarshan Nipen from TDH Nepal, and he's going to talk about gender unwashed in schools.
Good morning, everyone. Can people hear me fine from the back? Give me a little wave, just to wake you up, everyone. Sorry. And I have two honest revelations to make here. I'll be very honest, because I did not come here prepared to this presentation. So I need to thank Rajiv, who I proudly call Rajiv Dai, as a sort of a respect, being the elder brother, who I've known over the years, and who kind of introduced me to this opportunity to be the feeler. So here I am. And also to Kara, because I've learned about CWIS, but then we might have implemented it, but I didn't know like how conceptually the work that we're doing is contributing to that, which is an interesting opportunity for us. So I think in terms of my focus, it would be more using children and youth as a vehicle of social and gender and social inclusion within school communities would be the right angle to enter into. So in terms of the blue schools, and I'll also be like some of the other colleagues did, I'll also be sharing the resources, but I think without going in depth about it, it's really important to understand that this is a tool that was developed within the Swiss Water and Sanitation Consortium, and it was being rolled out in 6 different countries, and Nepal was one of the pilot countries where we actually piloted it, where we empower children and youth to be the champions of environmental sanitation as well as health hygiene within their school communities. And in doing that, they also were part of different clubs within the school communities, and they were keeping not only themselves accountable, but their parents, their teachers, importantly, and their community accountable. And we have some stories. I have something as a marketing tool. I always have something to show it to you. But if you're interested, I'm happy to sort of give you the hands out. It's really important to understand that it's not about children, but it's about using children for the transformation that we want to achieve. Here's an example. I think you can see that by working with children, particularly with children from different genders, and in the context of Nepal, especially in urban cities as well, toilets are oftentimes built for boys and girls. And if there are, children who identify themselves as sexual minorities and they wanted to have sort of a different perspective in the ways that we constructed toilets. So it was also fed in, and we implemented in one of the sample areas. As I was saying, the main locus of our focus was to actually invest in children and youth so that they become champions, and they become sort of motivators and catalysts for the overall cleanliness within the schools and their communities. And I wanted to sort of take you through some pictures. Now, it's not very, very clear, but I think here are some of the glimpses of the type of activities that children are engaged in. So definitely installation of wash services, and then therefore hand washing was our main entry point, and we really encourage children to do it. And this project was being implemented during the COVID hit time. So definitely it had significant improvements and also improvements in the behavior change communication through children as well as among children. So that was one very strong pillar. The other one was, as you can see, the garden initiatives. In some cities, in some areas, they also had space where they could grow their vegetables. And the idea was that they could grow something in their schools that they could also bring back in their houses or families. And then that could also contribute in the environmental conservation. And the other piece was also menstrual hygiene managing, where children, particularly secondary level school students, were also investing their times to learn and more skills, and but also making sure that these products are useful for them. So it's like using the skills, giving them skills, but also making the use of the product for the better management. And the other piece was also in terms of the solid waste. And as you can imagine that in the junkie culture, where a lot of plastics use are being are happening in all the cities, I think one of the most important areas where children and youth were very instrumental was to actually minimize the use of plastics, but also use of plastics or reuse of plastics in creative ways, which we would have never sort of thought it in the ways that the children presented themselves. So yeah, as I was just mentioning, the reusable sanitary pads was also one of the examples, and the local municipalities got really attracted with the idea of children fancying them and making the use of them, and then also children having the bargain with the local municipalities to say, hey, in our school we want to build this and this, and now that we are able to do this and we are not able to do, these are areas where we would need your support of funding on, so that they were kind of liaising and advocating with the local governments to do that kind of programs for them. So in summary, I think some of the learnings that we have accumulated over the years is that empowered children and youth, and by empowering them, it's really investing in children and youth. As we were also listening in the opening plenary session, we were talking about what is the next, like what is the future? How do you ensure the intersectionality? How do we ensure that the gender diversity and all the minorities issues, how do you collaborate with them? And children and youth are one of the groups that actually has less biases, if I may say so. And they were such powerful tools as they were influential in their schools, within their families. If the children insist on creating sort of changes, and then also challenging the harmful social norms, it was totally possible, as opposed to NGO workers or the municipality workers fighting for that. We learned that it was a lot more powerful as a tool to actually empower children to do that kind of work. We also understood that in terms of the engagement of school, it's also one thing that we noted. Schools were earlier seeing children as a central part of it. Let's be honest. Of course, they loved their children. That's why children were there. But I think they didn't see the value of children having that kind of engagement. Initially, of course, there were a lot of restrictions, a lot of reservations from the parents as well as from the schools as to we might be diluting them, engaging them in different kind of activities. But over the years, they learned the value of seeing and using children as a vehicle of positive change within their environment and community, and that was very well taken. And as children more and more became the change agents. So I'll not keep you for long. I think here are some of the tools and some success stories, and I'll always be available to respond to any questions you may have. Thank you.
Thank you very much. We have had 3 wonderful presentations from India, Indonesia, and Nepal. So now I think we can have some questions, allocate time for some questions. So if you want to ask questions to any of our presenters, please go ahead. See, I see hands in the back. Maybe we need to use this.
So who is hand pass?
Oh, at the back.
I can't see that.
Hi, I had a question for this current presentation. I love that you're talking about menstrual health and addressing menstruation and menstrual needs in schools. I was wondering about the sort of the making of the reusable pads, because evidence from low middle income settings show that like making sort of these micro initiatives to make your own pads is not successful. They're very poor quality. So I'm wondering how you evaluate, like, did you evaluate the quality of the pads, sort of the leaking, the materials, all that sort of thing, the durability? I'd love to hear about that.
Can I have the next question as well before responding? Oh,
I really appreciated the last two presentations highlighting the importance of finding kind of influential people or groups in helping to support these initiatives. So I was wondering for the first two presentations, Soumya and Anurag, did you find that you needed to engage kind of influential parties to help support women-led initiatives? Just in order to kind of help advocate for some of these changes.
great. Any other question from the back before responding? Okay, Rajiv. Yeah.
So I have a question for Anurag. He talks a lot about the earlier part of GC, like gender, women, self-help group and all. But I mean, can you also explain your initiatives for social inclusion and also the different behavioral people, if you have been doing anything?
Okay, there's a question over there. Take that.
Hi, this question is for the first presentation from CREA. I hope you're still online listening. So my question was, I think this approach of the 6 Cs is really helpful. And I was wondering if you happen to have maybe an implementation guide of best practices, some way we can take those 6 Cs and really put them to work.
Okay, so the first question was to Darshan, if you can, you can answer about the quality of the pads being made.
Absolutely. I can get you for the online. Hi, thank you for the question. I have to sort of point us to that, and I agree with you that when we started, we were not quite sure where to go with that. But fortunately, as a part of the Swiss Water Sanitation Consortium, we also had that intention of being or having partnership with the private organizations and companies. Actually, that's where we kind of used that loop in, and we collaborated with the private company who, without any cost, went down to the areas and then they ensured the quality of the pads that were being made. But I appreciate that you brought that point out, because we were also cautious initially and we didn't know what to do. Thank you. I hope I answered your question.
Okay, and then Anurag, please, about the social inclusion and the other questions.
Right, thank you so much for the question. I think if I've understood your question right, you were meaning to ask if we had to use any influential people to gather the committees together and hence become operational. The short answer is no, but I would say there's immense diversity across India. And as you saw, we were working in Odisha in the east to Rajasthan in the west. And there were different methodologies that we adopted. For example, in the east, generally women are more vocal as compared to the western and northern parts of the country, which are a little patriarchal in their approach. In Rajasthan, for example, there were, the men would be keeping an eye on what is this group doing, but they wouldn't intervene. And they'd be just curious to see, and they saw, okay, they're talking about toilet, water, okay, and they're not interested. But had you been talking about providing housing or any other asset, then the men of the family would be much more interested to know and be part of. So in the East, it was not like that. So there was variation, but we didn't have to use anybody influential. In fact, over a period of time, one of our member from the slum committee in Rajasthan in Jodhpur city, she fought elections, next municipal elections, and she got elected as a councillor. So that was the level of empowerment, that was one human story that we also published. That was, reflected on how a congregation of 10 women can lead to so much of voice and agency. Regarding your question, Rajiv, about social inclusion, we conducted a survey about 30,000 households across the 4 cities that I mentioned. And the persons with disabilities were about 2.3%. And that's pretty much in sync with what the national average is. And we did explore how can water sanitation facilities for the persons with disabilities can be provided. Most of them had individual household toilets, So that was being taken care of. In the public and community toilets, I think there were basics standards that were maintained for wider doors and unobstructed access and things like those. But I'll be honest, but nothing beyond what was mandated as per the regulation and bylaws. Regarding transgenders, in terms of social inclusion, there's a group that runs a fecal sludge treatment plant in Odisha. And, that was the first group that started running an FSTP, and then now there are many more who are doing providing other municipal services. And as like Soumya mentioned from CREA in the beginning, they are highly discriminated against transgenders. So they're begging, they do sex work, they're, at times they've been involved in extortion, drugs, and many other, such activities. But giving them again this platform of an SHG empowered them, because now they had a voice and they can walk to the municipal office and say, we are here, we can run a facility for you, or we can do something else, or we can, be a part of your municipal service delivery mechanism. And that was the social inclusion part that, came out very starkly from this, both the experiences that I shared.
Okay, thank you very much. Soumya, you want to respond about the best practice documentation and CREA?
Yeah, the question was not very clear. Can you please repeat the question?
Yeah, can you repeat? I'll just repeat it to her.
Yeah. So the question's around implementation, the 6 Cs, awesome framework, and how can we take that and best practices or implementation guide, how do we take that and really implement it?
Okay, so the question was about the 6 Cs and how you can take this framework and go towards implementation, or how you can, pretty much. Is that clear?
Thank you. Yes, so the larger framework and the understanding of 6 Cs is there on the CREA's website and is also explained really well. The only thing is when we pick it up, we also make it very specific to the context. So currently we have made it very specific to the India context, and you can refer to it, and it is very well explained also. And also we are in the process of putting up it in an online repository in the context of WASH in India. So I hope that would be helpful, and it will be available on CREA website.
Yeah, thank you. Thank you very much. Now we come to the final two presentations. This one will be by Alauddin Ahmed, findings from the MUSE study in Bangladesh. And like to try your best to complete the presentation within 10 minutes so that we can have some time to discuss it.
Thank you. Of course, I will try to finish as quickly as possible. And if some of you was in the 23rd session that we had, some data will be repetitive. So for them, I can move more faster. From the ITN side, as a regional capacity building hub for South Asia on citywide inclusive sanitation, we had the opportunity to conduct this research with the global initiative, where the MUSE stands for Measuring Urban Sanitation Empowerment, and the expansion of choice and strengthening of voice through the transformation of power relations. So women and girls have more control over their lives and values. So that is the primary motto of the MUSE, and it is a global study led by the Emory University. And from that study in Bangladesh, we conducted the study in 2 cities. As you can see, the other cities are already in your screen. In Bangladesh, it was initially carried out in Khulna long ago, but recently carried out in Meherpur and Soyodpur. I'll be presenting the findings from that study. The study focused on the empowerment domain, which includes agency, resources, as well as institutional structures. All these 3 domains also have subdomains. I will not go very detailing because the findings will have the subdomain wise results and figures. So you can figure out that from the findings. But the agency also have subdomains similar to the resources and similar to the institutional structures. Now here, Of course, I will focus on the findings. It is up to you to decide whether women in these two cities are sufficiently empowered or not regarding sanitation regular decision making, and those sort of things. The study started in 2021. Field data collection, analysis, all this took place, and finally we started disseminating the study findings, starting with a city level dissemination from February 2023. There was national level dissemination as well, and there were a dissemination at policy level through the policy briefs as well. As you can see, in Soyodpur, it was 729 women who were surveyed, and in Meherpur, it was 720 women. So total around 1,449 women were surveyed and data collection was done. But the more challenging from this number was the number of questions involved in questionnaire. There were 350 plus questions only on the empowerment domain. And if you also see the other city specific questions, the COVID related questions, sanitation and outcome related questions, total number of questions for everyone to respond were at least 600. And if you have answered some of the questions, yes, there were additional questions. So for some, it was more than 750 questions to be answered. You can imagine the volume of the study that happened for that domain. Regarding the demographic, there wasn't much difference in average age because one of the pre-criteria for responding to the questionnaire that you will have to be adult over age of 18. So, however, the marital status, if you see at Soyodpur is around 85 compared to 91% in Meherpur. And education status is important. It is also very similar, 86% in both cases for the primary education or higher. And time is spent outside home around 1.8 hours average for Soyodpur, which is 1 hour, a little less in Meherpur. Regarding sanitation, 91% use privately owned facilities and 83.1% use in Meherpur for that privately used sanitation facilities. And 94% reported their sanitation facilities are lockable, which is a little less, 84% in Meherpur. So a sanitation facilities, if it is not lockable, whether it related to dignity or safety or not, that is also up to you to decide. Definitely, we are not concluding with any result here. Water collection for sanitation use facilities, 28% need to collect water at Soyodpur, which is 33% in Meherpur. But the most important that out of that, some of them also need to pay for collection of water, which is 14% in Soyodpur and around 43% in Meherpur that need to pay for water. And the administration findings, as you can see, 2.2% avoid income generating activities during administration in Soyodpur, which is around 7.3% in Meherpur. And for ministerial product or ministerial management, for around 50% dependent on sometimes else, probably to husband or head of the family household for their product, which is around 60% in Meherpur. The impact of COVID-19 also saw that they had difficulties in purchasing sanitation related products and items, that is 62.4% in Soyodpur and 41% in Meherpur. And of course, they also spend more in caregiving and sanitation related product, 17% in Soyodpur compared to 26% in Meherpur. Let's now come to the empowerment domain, first with the agency domain, which have another 4 subdomains. Regarding the decision makings, 86% respondent participated in household sanitation related decision-making discussions, which is a little bit higher in Meherpur. However, in Soyodpur, 22% respondent told that their voice in community meeting is heard and they could influence around 4.3% cases of decision-making process, which was much less in Meherpur, only 4.4%. And in Soitpur, majority respondent agreed that they are capable as men, 92%, when it comes to perform a leadership role, which is a little less, 83.6% in case of Meherpur. And in the freedom of movement, almost 100% don't need to take any permission for movement or when going outside home, but 53.3% reported that they could go community meeting training outside of their neighborhood alone without asking permission, which means almost 50% need permission to go to such a meeting in both the cities. In the empowerment resource domain, if you come, again into several subdomains in terms of resources, 30% of women who reported they feel safe while using the sanitation facilities at night. And in Soitpur, 9% women in Meherpur face the risk of being physically harmed by men, boys, or other areas when they go use sanitation facilities during night. The privacy concerns was also found by 11% respondent in Soitpur and 23% respondent in Meherpur, which means their privacy is compromised due to the latrine settings and its construction. The financial and productive assets in Soitpur 46% and Meherpur it is around 48% women reported that they would need to be asked permission before spending any household money or similar things for maintenance of sanitation facilities like toilet cleansing products and other things. Also, time management, social capital, and knowledge and skill all have their differences. I'm not going to much details due to the time limitations, but as you can see, Soitpur is little bit better in almost all these scenarios compared to Meherpur, and they are affected differently. Now, if you see, around 66% responded agreed that they need to delay use of their sanitation facilities because of other priorities imposed by men's or other household members, which is around 78% for Meherpur. Again, whether that is also affecting empowering or not is a critical question as well. Now, regarding last domain, the institutional structure, I'll be very brief about it, the norms and relationships. Usually, women are expected to maintain the sanitation facilities. It is 98% responded, and so it could told that it is a woman's job, not a man's job, which was around 81% at Meherpur. And in both the municipalities, around half of the respondent reported that their families and local authorities are supportive to the sanitation related issues. In other way around, you can say 50% is not supportive in regarding sanitation related issues. So the way forward, I am not going definitely. As a part of global study, we did it, and we know some of the empowerment domain status of both the cities. What we understand through the gender and social inclusion process is that actually why do you stop? Whether we do carry out such studies in rest of the world, in USA, in Europe, and we compare whether we belong closer to them and then we stop, or we continue to improve till we reach 100% in all the indicators. That's the recommendation we want to get from such a learned audience. Thank you for patient hearing.
Okay, thank you, Aladdin Ahmed. We'll part the questions later. Now for the last presentation, Mr. Uttam Kumar Shah. Yeah.
Okay, so welcome again. My presentation is about the gender mainstreaming into citywide inclusive sanitation. a discursive perspective and gender approaches to inclusive sanitation. And I work with the practical action, and you all know that the practical action is an international development organization, and we are working on the inclusive sanitation work since quite long years. So let's talk about the Bangladesh perspective, gender in urban sanitation. Of course, the women's urban sanitation needs are very often actually overlooked. And because of this, poor urban sanitation leads to health risks, especially for the women. And particularly not only Bangladesh, but also in South Asia, women in South Asia disappropriately handle domestic sanitation duties and limiting education and other work and other opportunities for them. So that's why actually we are talking that if we want to address the gender in urban sanitation, we are talking about the inclusive sanitation and integrated sanitation that also covers the waste management, which can actually ensure all needs are met and also opens up new economic opportunities for the women and a better life and the safer and clean environment for all city dwellers. So like the gender mainstreaming from the presentation from Kara, we saw that we have the gender, the citywide inclusive sanitation framework, where we are talking now that the gender mainstreaming into that processes. We believe that the gender mainstreaming is a complex work, and it is really straightforward and not very linear. So that's why from practical actions experience, we have adopted a cyclical process. Like we try to do something and we review, and then we learn and we refine and again review. So that is a continuous improvement process that we actually follow. In terms of the gender mainstreaming, that is our target, but that we are actually adopting in 3 different levels. First at the community level, and the second tier is at the local council level, and the third tier is about the national level. But the strategies, all these 3 levels, the strategies include the empower women and vulnerable individuals, and engage with the men, because when we are talking about the women, but actually we need to focus on the engagement with the men and the local power holders, because without them, actually, it will be very difficult to achieve the mainstreaming of the gender. And also the influence the systems and policies to maximize their impact. So that kind of actually strategy we are adopting. So let us share some of the impact of what we have already found in the ground. Like if we think about that, in the ground level, there are 2 different perspectives. One is the service user, and the other perspective is the service provider. So service provider, we found we have already established a number of cooperatives, more than 50 cooperatives, and many of them are exclusively for the women cooperatives. And not only the forming the cooperatives, but also we have supported them that women and ensure their voices heard in traditionally male-dominated profession, and we facilitate the engagement of this cooperative with the municipality for delivering the services. And within this cooperative, we found that around 33% members of the PTMTS cooperatives are women. So that is kind of a new learning for us. And if you talk about the community level process and impact, what I mentioned that the service user level, we are focusing on the participatory planning process that actually empowered the women leaders, and basically so that they can actually advocate their needs. And because of this planning and the forming this engagement process, we found that there are already different outcomes we have already achieved, like the female-friendly, accessible public toilets with the ministerial hygiene facilities, and the child-friendly facilities are also there in some cases. Yeah. And women's cooperative also managed these facilities. It's not about only the building, the construction of the facilities, but also the operation and management of these facilities. We found that many of the cooperative members are also now managing these facilities with the service level agreement from the municipalities. So that is the one of the process. So let me share about the local municipality level, what actually we are doing within the municipality. So that's why at the community level, there are different cooperative of the women service provider, as well as also the community organization for the slum dwellers. Now we are integrating them into the city level platform, so that they can effectively talk, they can confidently talk with the municipal policymakers about the planning, about the budgeting, about the decision making. So those part, and we are also providing offer for training and coaching and mentoring services for the municipal leaders as well, and incorporating main and finding the local male JC advocates as well, because without an advocate, sometimes it is very difficult to achieve. I mean, we can organize some of the events that actually cannot make any effective change. And if I talk, we have already, because of this engagement of the local council, we found that in some of the municipalities, they have already taken initiative to provide the equal payment for the male and female worker. Earlier, there was a payment gap was there. And also they have recruited in some of the cases female staff who can provide the gender appropriate responses to the women's queries. And of course, the service level agreement between the municipalities and cooperatives that are actually allowing more economic opportunities for them. So let's talk about the national level. So we are not limiting, these are the very, the small scale evidences, but we are not limiting within the municipal level. We are trying to share this learning at the national scale, and not by ourselves. Basically, the people who actually make the changes, like the community leaders, like the local JC advocates. So we are bringing them and arranging dialogue with the policymakers in different platforms, especially for the sanitation related platforms. So we have already achieved some of the things at the national level. This is not only because of the practical actions work, but also contributing the other sectors, combining with the other sector stakeholders partnership. So JC already integrated into 2 different national policy, that is policy for framework for the fecal sludge management and national action plan. And now we are creating a national platform for the workers. And National State Agency, they develop gender and wash manuals. And now the government is preparing the wash sector development plan where RTN is actually leading. So we are talking together that how it can be a gender aware wash development plan. And very recently, the Bangladesh government also developed the National Ministerial Hygiene Management Strategy. From practical action, actually, we supported this strategy. So still, the change is still needed. We do not think that we have, we still have many things, especially at the using the community level toilet and the public toilets, the awareness of the people, especially the men, for reducing the harassment, and strengthening the voice of the women in sanitation governance, finding champion, especially the city mayors who have the influencing power, and aligning the sanitation plan with the poverty reduction and gender action plan and strategies. So that is also one of the other things that we think that is still needed. I have some question I'm not reading here. I have put it for the moderator. So that's all about my presentation. Thanks for listening.
We have actually 2 minutes left, and maybe we can only 2 questions. So if any question for Alauddin Ahmed or Mr. Uttam Kumar Shah. Yes. Yeah.
Thank you. My question is for actually Alauddin. How ethical it is to use a 750 question long surveys to implement. One, and then I'm thinking of the fatigue level of participants. I'm assuming they will be fatigued by halfway maybe of the instrument, and then how much can I really rely on the results that you presented? And I know it's a difficult question, and you don't necessarily have to answer, but something for all of us to think, how ethical it is really. And then my question is that how long did it take for the participants to finish the survey? And then how much were they really compensated for their time?
Yeah. Good question.
Okay, thanks for nice question. This is the debate that we had at least in 3 long meetings with the Emory University and how to go about it with such long questions. Definitely their time was compensated for that. I'm not mentioning what is the rate, definitely not the rate of USA or Europe in Bangladesh, but let me share other side of the story. That's what happens when you go to in the field. Actually, what we anticipated from professional point of view, whether how effective it will be, how long it is gonna take. Let me also give you answer on the timing as well. Initially, it took around 4 hours for one participant. Later, it came reduced to around 2.5 hours to 3 hours at max. Because some of the questions were yes, no type and very little open-ended question. But what happened, the sampling was, snowball sampling. So escaping some of the families and go to the next families. And after doing, around 10, 15 household survey, and when they were getting compensated, the other people start complaining, hey, why you are not coming to my household? I don't need to be compensated at all, but I want to participate in the service. I mean, either she's feeling like that I am sort of excluded, or my pride or my input is not good enough, whether it is something like that or not. So from professional point of view, you may think it one way, but in ground reality, actually the things is other way. But we could from, because there were checks of the survey, how it is going and whether things are happening or not, or whether the enumerators are speaking or not. The survey was in Kobo, nowadays, so you can trace everything. And all our supervisors reported back from ourselves also that it was done. Of course, for having 729 sample, we have to survey around 800 because somewhere definitely in midway told, sorry, I have a meeting to go or something like that. Yeah, thank you.
Okay, any question for Uttam? Yeah, there's one question. And that's the last one we're going to take.
I just had a quick kind of comment. I think I've seen a lot of survey and monitoring and evaluation discussions in this talk. I think we have to start looking into new or appropriate engineering tools to run this kind of survey, so that they're more precise and appropriate. Like we are seeing a lot of sensor and embedding systems, the monitoring system that could be good for citywide into the sanitation. There could be, I don't know, more like other like non-conventional survey techniques. I saw something that our doesn't have, like maybe question or something similar. That would be really interesting. Thank you so much.
Thank you. Yes, thanks for the suggestion. We are trying different ways, and we'll see a lot of examples here in this conference. So thanks to all the 5 presenters. Just to summarize it in like a few words here. So first we saw the examples from India, Indonesia, and Nepal. How participation from a gendered approach can give you good results, and how a woman's participation can be enhanced not only in the project design but also in the monitoring and evaluation. So that's something that we would like to achieve and we strive for in our development projects in general, and how that can be achieved. Also social inclusion. The next 2 presentations highlighted the role of social inclusion and gender incorporation of inclusion of youth and also women in institutions, how they can achieve positive results in WASH implementation projects, how the knowledge and skill can be enhanced, and also inclusion of children, how they can actually affect the viewpoints of the community and can bring a positive change. And that example is very much evident. The next 2 presentations from Bangladesh, of course, we just brushed the surface, I think, in the presentation. There are many conflicting results here because it's a very complex framework that we worked on, and you find conflicting results. Like you see positive indications in leadership, but you'll still see some disparities still happening in the leadership scale, you get a 88% kind of outcome. But let's see, if you look at disparities, that still persist. So these can be sometimes be conflicting, and we'd like to dig deep into this data to see what is actually going on. Finally, from Mr. Uttam, he has summarized nicely the practical action Bangladesh's initiatives and what they strive to achieve. So these initiatives that has been already been tested and trialed, and as he mentioned, that they work in a more iterative fashion. They tried, they failed, they tried again, modified their strategy, and then they succeeded. And these examples were practical action in Bangladesh. They have now can be accepted as gold standard for not only in Bangladesh but also in different other countries. And what they're trying to now, they're trying to scale it up and mainstream that through the city level authorities, and how this can impact in the larger domains like the donor funded projects and the nationwide projects. So some of these good practices are now being probably going to be implemented in some of these investment projects. If these are taken up, then we can see large scale adoption of these mainstreaming events. And when this mainstreaming occurs, we will probably see some good KPIs and good results, maybe in 5-6 years' time, both on not only in the social inclusion but also gender. So let's see what happens, and good luck to you all of you, and enjoy the rest of the conference. Thank you very much.
Thank you. It could have been even more. That's cut it off.